What is germline genetic testing, and really how does it impact the clinical care in our oncology clinics?
So basically, germline genetic testing is a specific kind of testing that is offered for certain types of patients who meet certain criteria. And it mainly focuses on testing your DNA that you were born with, okay, from a sample that could be either a blood sample or a saliva sample. And it looks for inherited alterations or errors in your DNA or specific genes. And those are known to be associated with increased risk for certain kind or kinds of cancer, including like breast cancer, colorectal, ovarian, and so on. And this kind of testing is considered to be a cornerstone of precision medicine because it focuses on the DNA that you were born with. And we know it is inherited because it can be passed on from parents to their children. Okay, and it also impacts the treatment or the management plan for patients based on the result, and that could be summarized briefly into enabling physicians into the clinic into providing the best treatment, selection, or into some surgical decisions, or even for increased surveillance and future prevention for our patients.
We do not test for germline testing for every single patient who comes into our oncology clinic. We do look for certain criteria, obviously based on international guidelines that do help us decide who are the patients who are eligible to be tested for germline genetic testing. Because that is known to some is that only 5 to 10% of the cancers are linked or are known to be linked to this day to germline genetic variants. The other cancers that are also can be common are not necessarily linked to a germline variant. So this is why we cannot really test, or we do not really necessarily test everybody.